Hello, staff. This is your chief nurse, Opal Chung. And so this year we're going to celebrate Florence Nightingale's birthday because unfortunately last year we didn't have the opportunity. So it had always been, her birthday is very special to me. Nightingale elevated nursing to a real profession. Yes, we're all still caregivers above all else, but we're caregivers with degrees, certification, knowledge of anatomy, pharmacology, medical equipment, the latest research, and so much more. In celebrating Florence Nightingale's birthday, I also celebrate each of you. This past year, particularly, has reinforced to me how much you contribute to this institution, how much I appreciate you. I give you special thanks during Nurses Week, but this year it will be different. We're going to celebrate the entire month of May. But in truth, I thank you every day of the year. I thank you every time you advocate for your patients and for yourselves. I thank you every time you present new ideas, creative ideas to improve your practice. I thank you when you acknowledge each other for work done well. Thank you for being partners with each other as well as with all your interprofessional colleagues. I'm especially proud of our nurse practitioners who provide the well-being of the community and improve the community health. When I do rounds to the units or in the practice, and you stop me to engage in conversation about a patient or a project, I thank you. I appreciate you every time you tell me what you need, and I'm always happy to do whatever is in my power to help you do your jobs well. Thank you for welcoming new staff members with open arms and offerings to precept or mentor our new nurses. Thank you for contributing to the Magnet Nexus newsletter and for working with me to achieve Pathway to Excellence designation. Working together, we will become the first hospital in Brooklyn to have Pathway to Excellence recognition. Thank you for embracing continuous learning. Our percentage of nurses with advanced degree is far above the national average, and more than 25% of you have become certified in a specialty. You are truly role models for believing in the value of education. I thank you for always working to improve our quality outcomes and our patient experience. Those two measurements are so closely connected to one another. We continue to set high goals for achievement in these areas and meet them. To all of you who have taken the COVID vaccine, I thank you with deep felt gratitude. You have shown that you understand evidence-based practice. You know that research supports the efficacy of the vaccine and demonstrates it is the only way to control this deadly virus and allow us to return our lives to something closer to normal. In taking the vaccine, you are doing something good for yourselves, your patients, your family, your community, and the whole world. Dr. Jean Watson speaks of nurses' acts of caring as being like a light, and every act of caring contributes to the larger light of the whole world, filling the world with kindness. You can think of the vaccine in the same way. Every vaccine counts towards our collective recovery from this devastating virus. Getting the vaccine is the responsibility of every person who works in healthcare. Many thanks to every one of you for your bravery and resilience, not only through our devastating pandemic, but every day that you care for patients. We deal with challenges all the time: hurricanes, storms, blackouts, mass shootings, personal grief. You know all the possibilities. Every day that you come to work with a smile and a readiness to take on whatever comes, you are performing acts of bravery. I wish you all a good Nurses Week. I wish you wellness, mindfulness, peace, and goodness. I am grateful for every day that I spend with you at Kings County. Working together, we can find joy through acts of caring. Thank you and have a great time.